Today I am going to answer a query asked by a viewer: is pregnancy possible with zero sperm count? Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. So now let us see what is zero sperm count. Zero sperm count is called as azoospermia. Usually if one sample shows zero sperm count, we advise the patient to recheck the sample with a gap of 1 to 2 weeks. If that sample also is zero sperm count, then we call it azoospermia. Even the semen analysis when we perform, we also confirm it by another method. After centrifugation, we also check the pellet to see any hidden or very low sperms in the semen sample. If that pellet also does not have any sperms, then we call it azoospermia. So now let us see how we treat azoospermia. Azoospermia can be of two types, which is non-obstructive azoospermia and obstructive azoospermia. What is the difference is, in non-obstructive azoospermia, the sperm production in the testes may be very low. That's why we are not having any sperms outside. In obstructive azoospermia, the sperm production in the testes is normal or almost near normal, but there is a block in the path where the sperms cannot come outside the body. So how we treat azoospermia is, we do complete evaluation of the patient, history, examination, scrotal ultrasound scan, blood test, hormonal evaluation, genetic evaluation. Once all these tests are done, we counsel the patient accordingly. We advise about the procedures which are available to take out the sperms from the testes. Some of the times we also put the patients on some medications like oral tablets or even hormonal injections before we plan the surgical retrieval of the sperms from the testes. Now there are different ways how we do the surgical extraction of sperms. One of the procedures which is commonly performed is TISA, which is testicular extraction of the sperms. Then there are other procedures like PISA, percutaneous epididymal sperm aspiration, or micro TISA in cases where we don't get any sperms in TISA. So these are the various techniques how we retrieve the testicular sperms. But when we are doing surgical sperm extraction, most of the times the number of sperms what we get is very less, and also they are not motile. So usually these patients cannot conceive with the sperms in IUI or naturally. So we have to counsel the patient for IVF before we plan their TISA procedure. So IVF is the option where the sperms are used for ICSI. We don't need motility of the sperm. The embryologist takes one egg and one sperm and injects into the egg, and next day we check for fertilization. So all the patients who have azoospermia require complete evaluation, followed by, if the patient is not willing for donor sample, trial TISA first. If the patient is willing to keep a donor sample backup, we also counsel the patient for simultaneous IVF cycle of his wife. So how we do a TISA cycle is, if the patient is willing for donor sample backup, we start the stimulation of the wife. We also put the husband on medications before TISA. On the day of egg pickup, we plan the TISA procedure. If we find sperms in the testes, we use the sperms for creating the embryos. If we do not find sperms in the testes, and if the couple has given consent to use the backup donor sample, then we use the donor semen sample for creating the embryos. So azoospermia is most of the times treatable if we take action in time, but it needs proper evaluation and planning either along with IVF or trial TISA. We also freeze these TISA samples for future use if in case the pregnancy is not successful in first attempt or the patient needs to come back for another pregnancy. So these TISA samples are also kept frozen. So this was about how we treat patients with zero sperm count and how you can conceive with zero sperm count. I hope this was helpful.